Good afternoon. I'm Kelly Sarmiento. I'm the Director for Outreach Programs at the Brain Injury Association of America. And on behalf of BIAA, I would like to welcome you to today's webinar, Concussion in Youth Football, What We Know, What We Can Do, and How to Protect Young Athletes. We are very excited that we're presenting this webinar in partnership with the National Athletic Trainers Association. So, as the voice of brain injury, the mission of the Brain Injury Association of America, or BIAA, is to improve the quality of life of people affected by brain injury across their lifespan. And we do this through advancing prevention, awareness, research, treatment, education, and advocacy. So, to keep up to date on BIA's programs and all the efforts we have underway, I encourage you to sign up for our newsletter by visiting us at biausa.org. And you can also check out other webinars we have scheduled over the coming months, get access to information on our professional education programs, such as those through the Academy of Certified Brain Injury Specialists, and other advocacy and educational campaigns. Now I'd like to pass it over to our colleagues at the National Athletic Trainers Association.
Hi, everyone. Good afternoon. Thanks for being here. I am Carly Foster. I'm the Senior Director of Education with the National Athletic Trainers Association, or the NATA. And if you don't know, we are the professional membership association for athletic trainers. And a big part of our work is making sure that our members have access to timely, evidence-informed education resources that support the care that they provide every day. So athletic trainers are often on the front lines of concussion recognition, management, return to play decisions. So conversations like this are really relevant to our profession and to our membership. We are so thankful for the BIA reaching out and asking if we wanted to collaborate on this webinar. So thank you so much. We strongly believe in the value of collaboration and bringing the organizations together. So thank you. If you want to learn more about our association, there's a QR code here, or you can visit us at nata.org. Thanks again for having us.
Thanks, Carly. We're also super excited and think this is a really wonderful opportunity to reach our various groups and this important topic. So just a quick reminders for those of you that have been with us before, you've heard these before. For those who are new, we just wanted to make you aware. All of the participants will be muted, but you do have the opportunity to submit questions throughout the webinar. To do this, just use the Zoom Q&A feature, and we'll really do our best to answer your questions throughout the presentation. And if we can, we're going to ask our speakers at the end. We'll be able to relate some of those of your questions to them, assuming we have time. If you don't get your question answered, you can always email us at brain injury. I'll do the email address on the other slide, but braininjuryinfo@biausa.org. All of the content today is going to be recorded, so you will be able to get access to it after. And also, just as a quick reminder, we're unable to provide medical advice during this presentation. So please, if you have any medical questions or concerns, we encourage you to consult your healthcare professional. If you also have questions about support or other needs during the brain injury journey for yourself, for a loved one, we also encourage you to reach out to the National Brain Injury Information Center. We have specialists that can help provide confidential information, and this is available at no cost. And you can call 1-800-444-6443, or you can email us at braininjuryinfo@biausa.org. And now I'm really excited and honored to introduce our two speakers. You are in for a treat. Both of them are not only wonderful experts in the field, but just amazing people as well. So our first speaker today is Dr. Donna Waltzman, and she's an associate research professor and research director within the Indiana University School of Medicine, Department of Physical Medicine and Rehabilitation. And our second speaker today is Johna Register-Mihalik, and she is a professor in the Department of Exercise and Sports Science at UNC Chapel Hill. And she's also a core faculty member in the Matthew Gefeller Center. She serves as a co-director of the Star Heal Performance Laboratory and Traumatic Division Director for the National Center for Catastrophic Sports Injury and Research. So with that, I'm going to pass it off to our first speaker, Dr. Waltzman.
Okay, so thank you, Kelly, for that wonderful introduction. I have no disclosures to report. So hi, everyone. During this presentation, we will cover what is a concussion, the current science of concussion in youth football, including signs and symptoms, risk factors, and why concussions are often missed or underreported. Okay, so sorry, one moment. My screen is causing problems. Okay. So let's first go over what is a concussion. A concussion is a type of traumatic brain injury, or TBI, from a bump, blow, or jolt to the head or body. So when there's a hit to the head or the body, the head and the brain move quickly back and forth. And this causes the brain to bounce or twist in the skull from the sudden movement. And this can lead to chemical changes in the brain cells, as well as stretching or other damage to the brain's tissues. And this can affect how the brain works. Concussions can change how a child thinks, learns, feels, acts, and sleeps, and each concussion is unique. For example, some kids get headaches, feel sick to their stomachs, or feel like they're in a fog while they're recovering from a concussion. Others may have trouble concentrating or feel like they're more tired than usual, making it hard to wake up for school. Concussion symptoms can look different from one child to another. Some symptoms may show up right away, while others may not appear until hours or even days after the injury. And most children will gradually feel better over time, often within a couple of weeks. However, a child may not notice some of their symptoms until they return to their usual activities, such as school, play, or sports. And in some cases, a parent or guardian may notice the changes before a child does. Recognizing a concussion can be especially challenging in young children and in some children with disabilities due to difficulty communicating or expressing how they feel. So if you're a parent or a caregiver, you know your child best. Pay attention to the changes in how they act, feel, sleep, or function during their usual activities. And if your child has symptoms that concern you, especially symptoms that are getting worse, seek medical care promptly. And be sure to share what you've noticed with your child's healthcare provider. Concussion is a common pediatric injury, which is estimated to affect 1.5 million children in the United States annually. Physical differences, such as a child's developing brain, thinner cranial bones, less developed white matter, underdeveloped neck musculature, and slower reflexes might place children at increased risk for TBI. Children may also take longer to recover from a concussion than adults, and several factors have been associated with greater risk for prolonged recovery. So these include older age, a history of previous TBI or intracranial injury, pre-existing conditions such as learning difficulties, lower cognitive ability, or neurologic or psychiatric disorders, as well as socioeconomic, family, or social stressors. So in addition to understanding why children may be particularly vulnerable to concussion and prolonged recovery, it's important to consider how these injuries occur. The one common cause is participation in sports and recreational activities. And from this point forward, I'll refer to these as sports and recreation-related TBIs, or SSR TBIs, which account for approximately 70% of TBIs among children. So when we look specifically at SRR TBIs that result in an emergency department visit among boys, contact sports accounts for almost half of these visits. When looking at individual SRR TBIs among boys, football really stands out. So with about 1 in 4 emergency department visits being associated with football. So this is a substantial proportion. So while concussions can happen in any sports and recreational activity, football represents an important area for concussion recognition and prevention, particularly in children and adolescents. And when we look more closely at the data on youth football, we begin to see some important patterns in when and how these injuries occur. So let's take a further look at what the data tell us. So there's more than 2 million children who play football annually. And so football and other sports promote the development of leadership skills, teamwork, and have psychological, social, and physical health benefits. And some examples of these include fewer depressive symptoms, improved self-esteem, improved social skills, learning how to work with others as a team, and higher physical activity levels. Still, participation in tackle football carries the risk for serious injury, including concussions. And due to the likelihood of collisions and contact between athletes, football is associated with the highest number of sports and recreation related TBI emergency department visits among boys, which was shown on the previous slide. And player to player contact is really driving this. So, some examples include tackling or during running plays. And this is responsible for more than 80% or greater of concussions. Age plays an important risk factor as well, with older boys showing a higher rate for football-related TBI emergency department visits. So this figure shows the change in TBI-related emergency department visits over time for football, baseball, and soccer among boys. So for football, in blue, there was an 86% decrease in the rate of TBI-related emergency department visits from 2014 to 2020, and then a 474% increase from 2020 to 2024. Though less extreme, there were similar decreases and increases for basketball and soccer. And while there was a large percent increase from 2020 to 2024 for football, the overall rate of SRR TBI emergency department visits for football did not change significantly from 2014 to 2024, though this does represent a 15% decrease overall. So concussions and other TBIs have become an important concern for parents, coaches, and others involved in youth sports. And while football has received particular attention because it remains one of the most popular youth sports, it also accounts for a substantial burden of sports-related brain injuries. At the same time, we're seeing some changes in how children are participating in football. So in looking at 2014 and onward, participation in organized youth tackle football has decreased by about 18%. In contrast, flag football has grown in popularity, particularly among younger children, showing a 67% increase in participation. So among kids ages 6 to 12, flag football has now surpassed tackle football in overall participation. But that pattern changes as children get older. So among 13 to 17-year-olds, tackle football is still considerably more popular. So about 6.4% of youth in this age group play tackle football compared to 2.8% who play flag. So what we're seeing is not necessarily children moving away from football altogether. Instead, particularly at younger ages, the way children participate in football appears to be changing, with more choosing flag football over tackle. Another important consideration is where these exposures occur, during practices or during games. So when we look at concussion rates, there's a striking difference between the two. Studies have consistently found that the concussion rate per athlete exposure is higher during games than during practices. So in one study of youth football players ages 8 to 12 years old, the concussion rate was about 26 times higher during games. And there are several possible reasons for this. So games tend to involve faster play, more unpredictable contact, and greater competitive intensity, all of which may increase opportunities for higher impact collisions. But the rate during a single exposure is only one part of the story. We also need to consider how often those exposures occur. The youth football players typically have more practice exposures than game exposures. So they spend roughly between 75 to 80%, or sometimes even more, of their total season time in practice. So even though the concussion rate is lower during practice, the cumulative amount of time and opportunity for contact during practice remains important when we think about an athlete's overall exposure across a season. And from a prevention perspective, this is particularly relevant because practices provide a more controlled environment. So the next presentation is going to get into the how, but coaches can modify how practices are structured, including the amount and type of contact athletes experience. So practices represent an important opportunity to reduce unnecessary exposure while still allowing athletes to develop the skills they need. Taken together, these findings highlight why we need to think not only about whether a child plays football, but also about the circumstances in which they play and the amount of exposure they experience over the course of a season. Another factor to consider is level of play. In one of our studies, we looked at more than 5,000 reported concussions among high school football players, and we compared athletes playing at the freshman, junior, varsity, and varsity levels. And what we found was interesting. Concussion outcomes were not the same across level of play. There were more concussions with higher level of play, so varsity players sustained more concussions than JV players who sustained more concussions than freshman players. And this has been supported by the literature. Additionally, among concussed football players, varsity football players reported a higher number of concussion symptoms. And in our study, this was a proxy for injury severity. But they also had shorter symptom duration and time to return to play. So at first, this may seem a little counterintuitive. You might expect athletes reporting more symptoms to have greater time for their symptoms to resolve and to take longer to return to play. But we actually saw the opposite pattern among varsity players. And while our study wasn't designed to tell us exactly why we saw that pattern, there are several possible explanations. At the varsity level, there may be more pressure from athletes themselves or from the competitive environment, so from parents, coaches, teammates, etc., to get back on the field. On the other hand, it's been shown that varsity athletes also have better access to athletic trainers and more consistent concussion management, which could also help them recover more quickly and return to play faster. So I don't want you to walk away thinking that varsity athletes simply recover faster. The bigger takeaway from our study is that level of play is another factor we need to consider when we think about concussion in youth football. The environment in which an athlete plays and the resources and expectations surrounding that athlete may influence what happens after an injury. And level of play is only one piece of the picture. So as we think about concussion risk in youth football more broadly, we also need to consider other factors such as age, how the game is played, and how much exposure an athlete has to contact. It's also important to remember that the numbers I've shown you don't necessarily tell the whole story. While some head injuries result in a diagnosed concussion or TBI, many may go unrecognized, unreported, or simply aren't captured in our data. And there are several reasons for this. Sometimes children or their caregivers may not recognize the signs and symptoms of a concussion. And because diagnosing a concussion relies heavily on someone reporting those symptoms, identifying these injuries can be challenging. For younger children, it may be difficult to describe how they're feeling because their communication skills are still developing. Older children and adolescents may recognize that something is wrong, but choose not to report their symptoms because they're worried about being removed from the game or missing out from an activity. So families may also decide that the injury seems minor and doesn't require medical attention. And for some families, there's very real barriers to getting care, such as cost, taking time off from work, transportation, or limited access to healthcare providers with expertise in concussion. And even when a child does receive medical care, a concussion can sometimes be missed, particularly when there are other injuries that require more immediate attention, such as fractures. And there's another important limitation. So where children receive care. Much of our national data relies on hospital administrative data, but not every child with a head injury goes to the emergency department. Some are seen by their pediatrician, at an urgent care clinic, or in another healthcare setting, and those visits may not be captured in the data that we've been discussing. In fact, one study suggested that these data may capture less than 20% of pediatric TBI cases. So when we look at the numbers I've presented today, it's important to recognize that they may represent only a fraction of the true number of injuries occurring in children. And so what we can count is not necessarily the same as what's actually occurring. In summary, football is one of the most popular sports played in the US among children, with more than 2 million children participating each year. While football provides numerous benefits such as socialization, athletic skill development, and increased health opportunities, Participation in youth football carries risk for concussion and other injuries. For boys, football-related concussions has the highest number of emergency department visits compared with other sports and activities. Player-to-player contact, young athletes developing brains and neck musculature, age, exposure, level of play, and prior TBIs and health conditions may make some children more vulnerable to sustain a concussion. And while concussions may be missed or underreported, it's important to know the signs and symptoms of a concussion. And if a suspected concussion occurs, to remove the child from play. Ultimately, early identification and treatment can help improve short and long-term outcomes and can help ensure that kids continue to stay healthy and active. Here are the references for the data I presented, and that brings me to the end of my portion of the webinar. So thank you for your time and attention today. I hope this information provides a useful foundation as we continue the conversation about concussion in youth football. And with that, I'd like to turn things over to the next presenter.
Thank you so much, Dr. Waltzman. Now we're going to transition to Dr. Register-Mihalik. And just a quick reminder, if you have questions, please feel free to enter them into the Q&A. And we will have opportunity at the end of the presentations to submit those questions to the speakers.
Good afternoon, everyone. And thank you again for the opportunity to continue on with this discussion that Donna started for us, moving really into thinking about best practices for management, as well as ways that we can promote overall brain health. To give you some background from my perspective, I am also an athletic trainer, but I am also a youth sport parent of a 14-year-old and a 9-year-old. Here are my disclosures. This is where my center has received research funding from over the past 5 years. None of these are in direct conflict with the material I will present today. As I mentioned before, our objectives in this second part are, when we finish, for you to be able to describe best practices for concussion management, particularly as they relate to removal from play, recovery, return to play, and return to learn considerations. We also hope that you'll be able to apply practical and evidence-informed strategies that families, coaches, and communities can use to help prevent concussion and promote brain health in youth sports. Before we jump into the objectives overall, I do want to situate our discussion in something we call the biopsychosocial approach. Some of you may be aware of this, but this is a way to think about concussion management, recovery, treatment, as well as our prevention strategies from a multi-pronged approach that considers the whole athlete. This includes considering the biological factors that our athlete brings to the table. It also considers thinking about the psychological aspects, both pre-injury and post-injury, that may be affecting our patient or our athlete. And then the third tenet of this approach and consideration is the social, how our patient or our athlete interacts with the world, their team, and the things around them. It's important to consider all of these because we need to assess where things are in each of these areas, and we also need to make sure that we're developing recovery and treatment strategies that are considerate of all of these factors for our whole patient. So now let's jump into thinking about some of the key best practices for concussion management. One of the ways we like to think about this is through the model that you'll see down in the left-hand corner, which is really simply put, thinking about recognizing that a concussion has occurred, and then responding to that recognition by removing any athlete that we suspect that has had a concussion from participation that day, and then going through a recovery process for that patient that is individualized, active, and monitored throughout their recovery pathway. Some of the specific ways that we can think about following through this recognition, respond, and recovery model are really considering the best practices that lead us to removal from play, the factors that are considered in an athlete's recovery and how to enhance that recovery, and then what considerations we need to put into play for their return to learn in school, as well as their return to sport and play. So we'll start and go through each of these 4 factors on the right. The first one being removal from play, and thinking about this in a broad perspective. The first thing we have to do is recognize that a concussion has occurred. This can happen from a medical professional standpoint. It may also be a parent or a coach or even a teammate. One of the ways we like to talk about this recognition aspect is that we don't expect everyone to have a full medical background because many folks don't. But just like we would know if someone put their hand over their chest and they said they had shortness of breath, and we would know to activate EMS because that person may be having a heart attack, we want people to use that kind of approach with recognizing a concussion and saying, hey, we think this person may have a concussion and we need to get them appropriate care, and then putting that in a medical professional's hands. A key aspect of removal from play is that any youth athlete suspected of having a concussion requires immediate removal from play and no same-day return. It also requires that that individual get a medical professional evaluation to either diagnose them with a concussion or rule them out. Another key consideration in removal from play and after they have been removed from play is picking up on any red flags or deteriorating status of that youth athlete to know if we need to activate emergency services or get them to an emergency assessment. Some of these red flags include things like the worst headache of their life, serious vomiting, losing consciousness. One of the big things to look for is if they have a lucid interval or they feel better for a few minutes and then they start deteriorating. Any of those things are going to be red flags that they may have something really serious going on, and we may need to activate an even higher level of care into an emergency assessment. It's also important to note that any athlete that's diagnosed with a concussion should not return to play or sport until they're cleared by a medical professional. So that clearance for them to return back to their sport should not happen from a coach or a teammate or someone beside them. It should come from a medical professional to ensure that they followed the appropriate path to be in the best situation to return to their sport. When we also think about removal from play, what happens when we get further away from the event? And one of the key aspects is that we remove them from play and we get them to medical care so that they can be properly assessed. One of the key things about the assessment of concussion is that there currently is no gold standard diagnosis. Donna mentioned earlier several symptoms and the way a youth athlete might present with those symptoms. And many times that is the first indicator that we need to start this evaluation process. Because we don't have an image, there's not a drug, there's not a special test, and there's not any kind of blood test or imaging that can yield us a confirmative diagnosis of concussion. We come to that through a multifaceted assessment and the many factors that you see here on the screen. So if we're a clinician, we're thinking about this multifaceted assessment from what we're going to do and what that information means. And if we're a parent or a caregiver or a family member, we're thinking of making sure that this kind of assessment is occurring for our youth athlete before they're being returned to sport and throughout their recovery process. So now that we have a general handle on some key ideas around best practices from removal from play, kind of immediate, and then through that assessment process, let's move to some general recovery considerations. I put this Band-Aid here on this slide for us to really think about concussion is absolutely not an injury that we can brace or put a Band-Aid on and think the athlete can just return to play. It is a complex injury that involves an injury to the brain. It's also important to know that recovery from concussion is an active process. We have several pieces of data, several studies, and a lot of clinical acumen that has been built around the fact that we now have rehabilitation strategies and exercise strategies that we can use to effectively treat concussion. We have moved more recently to this idea of relative rest in the first 24 to 48 hours, meaning an individual can do things like activities of daily living and move throughout simple things in their life and not recommend strict rest in the first 24 to 48 hours. We also really encourage the reintroduction of school and social participation very early in their recovery, with accommodations or adjustments to those activities as needed, as several studies have shown that this reintegration into school and social participation actually supports their recovery. As we think about this general recovery process, we also want to make sure that big picture things like sleep, nutrition, headache, mood are being considered as part of their recovery process. And then moving into even more specific things like cervical or neck issues, vestibular ocular, so our ears and eyes, and exertional problems. So being able to tolerate any kind of activity in their day so that we can consider the whole person, again, that biopsychosocial approach throughout their entire recovery. It's also important in this recovery process, like we talked about reintroducing school, and then that is progressive, to return to sport through a progressive process that starts with this relative rest, moves to exercise, and then eventually to sport participation or activities, and then full return to sport. And I'll talk specifically about return to sport here a little bit later. We also want to recognize, as Donna mentioned earlier, most people and most youth athletes actually recover within 2 to 4 weeks, and particularly within 1 month. But when we do see athletes that have symptoms after that time, we talk about that as having persistent symptoms after concussion. And this language helps us identify what they're dealing with and target treatments toward any remaining deficits throughout their process. When we think about recovery from a more specific standpoint, I wanted to share with you all where the evidence is situated, where the most studies and most evidence is situated for things that can best support their recovery in that active treatment process. And most of that literature, while there are other ways to treat concussion and other strategies we could use, most of the literature is situated in the 3 bubbles that you see here on the slide. In aerobics exercise interventions, targeted rehab, which is rehab that's targeted to a specific symptom or system, and then multidimensional rehab approaches, which is combining targeted aerobic exercise and potentially other interventions in the recovery process. Now I want to talk a little bit more specifically about exercise and rehab in this process. These are relatively new guidelines for people to consider, and there is a good body of evidence to support it absolutely improves recovery and outcomes. So first, about exercise. When we say early exercise after concussion, we're referring to aerobic exercise that can be started after that 24 to 48-hour window of relative rest. Studies have shown that prescribed exercise early in that process can shorten recovery and improve overall outcomes. Typically, this light aerobic exercise can start within 24 to 48 hours as the patient tolerates it. And that is really guided by letting them exercise in a space where their symptoms are not being any more than mildly and briefly exacerbated. Now, I know your question might be, what does that mean? You can ask the individual on a scale of 1 to 10, how are you feeling right now? And then periodically check in with them over the course of their aerobic exercise. And if their symptoms are not increasing by more than 2 points on that 10-point scale, and then they go away after the exercise or by the next morning, you're operating within a good space. If they increase significantly, then just reduce the exercise dose or intensity. This is a relatively new school of thought in terms of people really broadly implementing it. And sometimes it can be scary as a parent if you've never seen exercise used to manage it, or even as a clinician to use it. But it's important to know that some symptom increase will likely occur. And usually we see that improve over time as a result of the exercise loading the symptom. And again, this exercise is aerobic exercise, typically done at about 20 minutes per day. And that can be walking, riding an exercise bike, or even using a treadmill. Now thinking about the rehab strategies, I mentioned 2 different kinds where most of the literature is situated. That is around multimodal rehabilitation, where we're combining different strategies into a broad rehabilitation program. These strategies have been shown to be effective and safe, as well as relatively safe. So we think about that relatively safe compared to old standards of care, and that more standard of care where it used to be, where we would have people be asymptomatic before we move them through the process. If you're interested in what those paradigms might look like, we conducted a study at UNC Chapel Hill, and that protocol, as well as the exercises that we used, can be found here at this QR code. I think it's also important to understand the role of targeted assessment and rehabilitation. One, if someone has persistent symptoms, whether they've been engaged in exercise or rehab before that or not, it really yields us to thinking that that individual needs some additional targeted assessment and treatment, and they may even need additional referral. One of the targeted areas that we often see individuals struggle with after concussion is either in the cervicovestibular area, which would be their neck, as well as their vestibular system in their ears, or just vestibular or visual dysfunction on their own. Recent consensus supports the idea that if we continue to see these deficits and they persist beyond around a week to 10 days, we want to make sure they are getting those targeted treatments. And the evidence really supports that these targeted treatments significantly enhance their outcomes. So that moves us through the sort of recovery process to thinking about return to learn. When we think about return to learn, we can do this in parallel with their return to sport or return to play process. However, I want to reiterate that full return to school should happen before full return to sport. So while it can be integrated and done in parallel, we shouldn't have someone participating in the football game on Saturday morning that hasn't yet fully returned to school. We also want to think about, as they move through their return to learn or return to school process, that their adjustments or their accommodations need to be targeted to their individual needs and tapered off as their function improves. So for instance, if someone needed no tests and needed a reduction in screen time, over time, we would increase their screen time and move them back into taking tests, maybe with different strategies and then normal test taking. It's also important to think about this individualized approach, as some individuals do not miss school after their concussion, depending on when their injury happened or their overall recovery time and the signs and symptoms that they're experiencing. So this progression looks very different depending on the individual. The top table that you see here on the slide is from the International Consensus on Concussion in Sport and guides you through 4 key steps of having them start daily activities. That's really in that relative rest period. And then moving to school activities like homework, reading, screen time, and then moving into returning to school part-time and returning to school full-time if they need those kinds of adjustments. No matter what adjustments they need, it is really important as part of this process to monitor their symptom burden, their attendance, what their workload looks like and what they can tolerate, as well as their learning and their psychosocial response. As they're engaging in these kinds of activities, you can also use that 10-point scale I mentioned earlier about how are you generally feeling, 1 to 10, and then look and see how that changes. And if, again, they're being more than mildly exacerbated and it doesn't go away relatively quickly, that's when we want to think about adjusting their school or learning load as well. Then when we think about return to sport, we now think about this progressive set where we see these first 3 stages here that you see on the slide really indicate what we call therapeutic treatment or the therapeutic stages, where we are not putting that individual back into training environments, but we are allowing them to exercise and moving them towards individual specific activities that are clinically directed so that they are rehabilitating their injury. So we start the athlete at the top here where they would have symptom limited activity or relative rest in that first 24 to 48 hours. Then we would move to aerobic activity where we start with light activity and move into moderate. And again, that's that 20 minutes a day on a bike, on a treadmill, or over ground walking, where you are allowing them to operate in the space where their symptoms are no more than mildly exacerbated over a brief period of time. Once they tolerate this, we can, and they're not significantly increasing, we can then move them to individual sport-specific exercise. When they're doing this, we're having them do this where they are not at risk for getting hit in the head again, and typically not fully part of the team environment to ensure that we are not exposing them to an increased head injury risk. But there are ways at this stage to incorporate them back into more of a social context for their exercise, which we found to be really, really helpful for people after they experience a concussion. Then we move into the 4th phase once they have no more symptoms from their current concussion. So they're free from concussion symptoms. We then move them into non-contact training in the team environment. If they remain free of their concussion symptoms, we move them into full contact training. And then ultimately, if they continue to remain free and they're working through all of their testing that is matching their normal performance, we would return them to sport, our full contact return to play. It's important to know through this process, though, that a medical professional needs to guide this process and clear this process. Additionally, each step should be performed 24 hours apart. So you want a day in between each stage as they progress through this process. And we've really been finding good results with this, again, this aerobic exercise, and then targeting sport-specific and condition-specific rehab in those multimodal approaches that has really helped to accelerate individuals' recovery, but also help them more successfully return to their sport at all levels of play, from youth to high school, all the way up through the college and professional ranks. So now that we've worked through our first objective of thinking about those best practices in a broad scope, Let's now think about concussion prevention and brain health promotion. I want to talk about 5 things in this space that we can consider as community members, as family members or caregivers, as well as coaches, parents, or other key individuals who may be in the sport community. And those are coach and parent education, playing by the rules, reducing head impacts, keeping care-seeking pathways open, and promoting a culture of whole person well-being. So the first area I want to talk about is coach and parent education. All of the states in the US, including the District of Columbia, have some type of concussion legislation. That concussion legislation typically includes 3 tenets. One is no same-day return, which we already talked about earlier. The other is clearance from a medical professional prior to return to sport, which we mentioned earlier. And the third is some kind of educational component for coaches, parents, and sometimes athletes, as well as individuals surrounding those athletes. When we think about coach and parent education, though, I really bring this up for the youth community because coach and parents have such a strong influence on youth athletes. So some things I want to highlight is that education can improve concussion knowledge, but there are several studies that show that knowledge alone does not reliably change behavior. If we don't put people within systems and promote a culture of safety, and we don't give people the tools and strategies, they can know all the things in the world and behavior and outcomes don't change. So education is very important, but it also becomes important to not just give people sort of book knowledge, but also to educate them and train them in specific skills and strategies that help support concussion recognition, response, and recovery. The second goes into that we want to make sure that in this education, we're addressing recognition, removal, reporting, and recovery expectations. We also want to make sure that adults who surround these youth athletes, and particularly in youth football, how should adults respond when an athlete speaks up? The way that adults respond to a teammate having a concussion, to another child having a concussion, influences the way the next kid who gets a concussion is going to respond to their own injury. So really creating an educational component that really promotes that culture of safety is very important. The other thing that's important to note about education for coaches, parents, and really athletes and others as well is that we really need repeated and context-specific information, as well as behavior or skill-focused in education that we have versus just a one-time informational session. A lot of times education, particularly for parents, is given at a beginning of season meeting for parents, and then it's never talked about again. And so we can really talk about informal education being very important here, because that again shows that things are in conversation and that people really care about the safety of the youth athletes and the youth football players. We also want to really educate coaches and parents about how much they shape youth athletes' perceptions and their response to things, particularly around concussion, because you can't see it. And it requires that youth athlete to really seek care, tell people about their symptoms, and then follow through on several things. And if we have coaches and parents who aren't supporting that, it can be a really tough environment for a kid who has a concussion. So that education needs to include those components. Another key component in this area is thinking about playing by the rules and considering the policies that help drive these rules. We know from the literature, and there's a really great systematic review from 2023 that's in my list of references and referenced here, that looks at prevention mechanisms for concussion. And what we know from that is that policies and rules, as well as their enforcement, can meaningfully alter concussion risk. Particularly things like age-appropriate contact rules and around limiting contact practices are among the clearest evidence-based prevention strategies. So to Donna's point from earlier, most concussions happen in practice. So if we can limit exposure to head impacts in practice, we can limit the number of concussions. And so several policies and rules have been put in place in different areas and in different age groups to really mitigate those contact practices and to help limit that without a detriment to performance. Now, one of the things that's an issue here is sometimes this doesn't make its way all the way down to the youth level. This is really at high school, college, and pro, where a lot of those things have been regulated because it's easier to regulate in those environments, given that there's no one youth sport organization that regulates football. But it is recommended to limit those contact practices and use other ways of practicing skills when they are at those younger age groups. The other is that prevention is strongest when formal rules as well as informal team norms go in the same direction. So meaning if we have things like a rule like targeting, don't hit with your head and don't aim for someone else's head, that needs to be reinforced at practice and as part of drills. If it's not, there's a misalignment and we're not really seeing the progress that we want to see. Another example of kind of a pathway to effectiveness for playing by the rules is that coaches teach what is acceptable at practice, right? So we're not going to lead with our heads. We're going to keep our heads out of the tackle. We're going to limit our contact practices. We're going to work on being a whole and full athlete. And then officials reinforce rules. So just like the targeting rule, we need officials to enforce that. And then leagues can set standards for incentives around people following the rules and promoting the right team culture. So those are some examples or a pathway to helping move these things forward. When we talk about playing by the rules, we also mean playing by the literal rules. So there are several studies in both ice hockey and American football where we can see that when people have an infraction or if they commit a foul or if they harm another player outside of the rule set, we see concussions happening more often and more severe head impacts happening in those situations as well. So literally playing by the rules can also be an important prevention measure. The other component, and again, Donna mentioned this earlier, that we're not just concerned about concussions. We also want to reduce exposure to head impacts for that cumulative lifelong exposure. And we want to do this as a practical intervention target because I think all of us can agree that getting hit in the head too many times is not a good thing. And we want to think about how to modulate that, but also alongside athlete and skill development so that if they want to continue the sport, they're able to do that in an effective and a safe way. One of the ways that that has been done, I mentioned earlier, is limiting contact practice in American football has been associated with lower practice-related concussion rates and obviously decreased head impacts. So really thinking about ways that you can still accomplish the goals you want to accomplish, but reduce the impacts to the head. So limiting contact practices is one of the strategies that can be used. Another is teaching tackling techniques where we don't use the head, right? We have a colleague, Dr. Eric Schwartz, who's at the University of Hawaii. If you're interested in different tackling techniques and strategies, who's developed a strategy with helmetless tackling to keep your head out of the tackle in practice and then progressively moving towards different tackling techniques. It's also important to think about equipment. So protective equipment is absolutely helpful. Some helmets are better than others, right? We want our helmets also to be in a good condition and we want them to be properly fitted. The last study that we did with our team when we looked at ice hockey and youth football athletes, only 40% of helmets were properly fitted, and other studies have even showed a smaller proportion of them. When helmets aren't properly fitted, they can't work the way they're supposed to. And helmets do a great job of preventing moderate to severe TBI or those more catastrophic brain injuries, and they can also in some ways help dissipate forces. But what I also want to reiterate is that protective equipment is never concussion proof and it's not head impact proof. It's meant to mitigate some of those effects. And you want to make sure that you're listening to the marketing approach carefully. One thing I also want to add about head impacts is that there's a lot of technology in this space to monitor head impacts, particularly in sports like football and ice hockey, to understand the exposure of head impacts. These tools really are to just understand the number and the type of head impacts people are experiencing. They should not be used to diagnose a concussion. And really, they're not even at a place to be used to pull someone out of their athletic event because that's not how they were designed. And we don't truly understand what those thresholds are. But they can give us information from a research standpoint, as well as a practical standpoint, just kind of about the exposure or the load that someone may be experiencing. The next area is really keeping care-seeking pathways open. So our athletes, even at the youngest ages, need a clear pathway to seek care by a medical professional. And that's often opened up by their caregivers, their coaches, their school, their organization, or their parents. It's really important that athletes and their families understand who to tell if they've had a concussion, how to access care, and what will happen as part of that care, so that they really have a framework for making that decision and moving in the right direction. The second thing about keeping these care-seeking pathways open is responding to care-seeking with support. So again, giving them the information they need, encouraging them that what they've done is the right thing and that we want to protect our brains, and not responding that with stigma or negativity. And as a youth, parent, caregiver, or coach, that negativity could even look like us saying, man, I wish you could play tomorrow, right? We want to be very careful about the language that we're using to support their recovery and their overall brain health. We also want to do all we can to reduce barriers to care. Donna mentioned some of these earlier. Some of these are at a more system level, like limited medical access. So there's many situations where at the youth sport level, there's no athletic trainer or medical professional. They're more common at a high school or college or pro level. There's also maybe unclear procedures. We've seen in several studies at the youth and the high school level where even though people know they should tell someone if they have a concussion, it was unclear to them what would happen after that, so they chose not to seek care. There's also, even at the youngest levels, a fear of status loss. I'm going to lose my place on the team. I'm going to let my coach down. I'm going to let my caregiver down. I'm going to let my teammates down. And then there's also often poor communication, particularly in youth environments where there's not really a head medical person or someone who's the safety officer taking charge of these pathways. So really thinking about making sure those things are in place. The other thing is really to remember that coach, parent, caregiver, and teammate pressures, as well as their supports, matter. There have been several studies that have also shown that pressure from family members, parents, coaches, and teammates really impact an athlete's decision for care seeking and then being honest throughout their recovery process. So developing strategies and again, promoting that environment where we want people's brains to be healthy, and we talk about this more often than not, can really help to bring more of these into the pathway of care, which we know ultimately improves outcomes. Individuals who get care for their concussion within the first 3 days have significantly better outcomes than individuals who wait longer to get care. And then the last element of this is promoting a culture of whole person well-being. And I say it this way, in that if we create a youth sport, and particularly a youth football environment, where we do 4 things that we see here. We make brain health part of routine athlete health and team discussions. It's not just a concussion conversation. It's about things like sleep, nutrition, mental health support, overall recovery and rest. We're balancing those things with what we're asking them to do with sport. And we're creating supportive environments where our athletes can seek care without fear of loss of belonging or just overall fear of what will happen to them in general. These kinds of things done over time, I think, really create an environment in youth sport where not only do we see better concussion care, concussion prevention, and overall better care seeking, we see this happening for a lot of different things. When we have a really healthy youth sport culture, people thrive, not just they're not injured or their concussion gets better faster. We see those young athletes and their families thrive, and that will ultimately help the bigger picture. And then the last thing I wanted to mention about promoting a culture of whole person well-being is really this idea of collaboration. So there's a significant amount of data that shows post-injury after a concussion, when we develop a collaborative care team, so you have a physician, an athletic trainer, the family member, the athlete, maybe you have a physical therapist and a school nurse who are all surrounding that young athlete to care for them. Those types of collaborative care models improve outcomes over a single lane of care or no care at all. So really thinking collaborative. But I also think that collaboration can be done when we think about creating this environment. So how we educate people, what we talk about, the things we promote. When we are all in better alignment in a youth sport environment, it helps everyone have a better experience. So these are just 4 things and 4 areas, I think, that we can think about for promoting this whole person well-being that really makes overall brain health the bigger picture and not just thinking about it post-concussion. I want to leave you with a couple things. The first thing is I often show this slide in every presentation I give because I think it's important to note that anything we talk about with concussion, and I think this rings even more true when we talk about youth sport and football in particular, is that when we talk about prevention or recognition or care, it's not just one thing. Best practice concussion care and sport overall is a system. right? And we have things that are happening at our individual athlete level. We have things that are happening with the people that surround our athlete. We have things that are happening in the environment that our athlete is in. And then we have policies and laws and even societal views and pictures that are impacting the environment and the spaces that our kids operate. And so I think it's important to be aware of these things as we think about policies or strategies or concussion care models, that we can't just think about it at the individual athlete level. We have to think about it across this system. So I'll leave you with these two take-home points. One, concussion care is an active process that moves through that recognize, responding, and recovery phases. And then that we want to consider the whole person in both prevention and care. And then the last piece is that education, playing by the rules, reducing head impacts, and keeping care pathways open are ways that we can promote prevention, recovery, and overall brain health. I really appreciate your time today. I'm happy to answer questions here, as well as feel free to connect with me individually. I think there's no greater thing for us to consider than how we create a youth sport environment that helps people be as safe and healthy as possible. Thank you.
Thank you so much to both our amazing presenters today. I want to take a couple minutes to ask them a few questions before we have to finish up. So we got a good number of questions that came in, and I wanted to start with a question on something, Donna, you presented on in terms of the data. So we know there was a decrease during the COVID-19 pandemic in 2020, but one of our participants noted that the trend was starting to decrease before 2020. Do you have any thoughts on why that might be?
Yes. So if we actually so there is some data that I also didn't present. So if you actually take it back and you look at starting from 2001, there was actually a sharp increase in traumatic brain injury related emergency department visits for football. So from 2001 to 2013 was really that peak. And then in 2013, it really began to decrease. And so you saw most of that data that I presented. And so some of that could be, it could be related to rule changes, it could be due to changes in participation. And so and these are all great. And then one of the other questions that was also, I think, from the same individual was, it seems like it increased, it may have reversed after 2020. And so I also want to address that. And so at first glance, it really does look like the trend has reversed and the rates are increasing again. But I would be cautious a little bit about interpreting that way. So 2020 and to some extent 2021 were really unusual years, because of the pandemic. And so if we consider those years in that context, the more recent data may represent a return to pre-pandemic levels rather than a true new trend upward. And so at this point, I don't think we have enough post-pandemic years of data to, definitively say the longer term downward trend that we saw earlier has reversed. So we're going to need some more additional years of data to determine whether what we're seeing is a sustained increase or more of like a leveling off following the pandemic.
Excellent. Thank you so much. I'm going to pivot now to some questions we got on the recovery process. So I'm going to collapse some of them because of time, but one thing that came up is the role of substance use that could affect recovery. And the other question tied to recovery and what can affect it is, how do you know when aerobic activity, and I know you mentioned it's helpful, but why, do we know why it's helpful? I think you're, oh, there you go.
Yes. Anyway, my button wouldn't work. Excuse me. Thank you for that. Those are really great questions. So I'll answer the substance abuse question first. Absolutely any use of substances and even, prescription medications can affect someone's recovery, right? Depending on how they interact with that. I think I read in that comment, the desire for maybe messaging that you shouldn't use substances in your during your recovery process. I think that is a good message to deliver. We do know that those things can cause deficits that look similar to things in the concussion space. And so sometimes it is hard to tease that out, and we kind of have to go through an elimination process to figure that out. But I agree that some of that messaging could be helpful from an educational standpoint. Then I'll move to the recovery process question, which was, do we know what is happening? Some of the studies by Dr. Letty and his group, as well as others that have looked at some of the physiology, one of the big things is that one of the things that happens after you have a concussion is you actually have decreased oxygen availability in your brain. And aerobic exercise, right, can bring that oxygen level back up when done safely. So there's some things that have been circulating and some data that supports that might be part of that mechanism. The other is there is some thoughts that many of the different exercise strategies and some of the rehab strategies may be helping to support the autonomic nervous system, which we now know is affected after the concussion as well. So those are kind of the two areas that most of the physiology work is doing. But it's interesting because some of this work has happened backwards, where we found these things that were effective, and now we're going back to study the mechanisms.
Excellent. Thank you so much. So, maybe we can squeeze in one more question. It has to do with return to school and how to collaborate with school professionals, in particular speech language or SLPs. And I was wondering if you guys have comments on how to coordinate to make sure that kids get the help they need. Between athletic trainers. So I think we'll connect with Johna on this one.
Okay. So walk me back through the athletic trainer piece.
So how can athletic trainers coordinate with school professionals?
That's a great question. So oftentimes we talk about athletic trainers being the center of the hub, and being able to connect with the school nurse is one of the primary folks that we often try and connect with. Some school districts also have TBI teams, or folks who work with students who have different developmental and brain related conditions that can help support that as well. One of the issues we find, though, that's a challenge is sometimes a school nurse or some of those other personnel, the school counselor, the SLP, right, who may also be part of that school collaborative team, are not there daily. So working out a schedule with them or a collaborative group that maybe meets once a month is another strategy I've seen some other districts or schools use.
Excellent. So unfortunately, I think we need to end it there. If we didn't get to your question, I apologize. Again, please feel free to reach out to us at braininjuryinfo@BIAUSA. Really appreciate all the expertise that our two presenters shared with us. And thank you to the National Athletic Trainers Association for this wonderful partnership. And hopefully we'll have more in the future as part of this collaboration. Have a great afternoon.
Thanks, everyone.